Today we will be speaking with Dr. Kim Gauthier. Dr. Kim Gauthier is a cell biologist. She completed her Bachelor of Science in Biology at York University in Toronto, her Cell Biology PhD at McGill University in Montreal, and she is currently a postdoctoral research fellow at the Research Institute of the Hospital for Sick Children in Toronto, Canada. Dr. Gauthier specializes in cell signaling, protein trafficking, molecular biology, and developmental genetics. She is also a volunteer vaccine educator with COVID-19 Resources Canada. Hello, I'm here with Kim Gauthier today. Kim, thank you so much for joining me for this conversation. You're in
Thanks
Toronto. Yeah, no problem. It's great to have you here. Kim, one of the reasons that I invited you here is, well, first of all, we're both part of the COVID-19 resources group. So we are volunteers from, I guess there's a group of us from across Canada volunteering to help educate the public and answer questions about the vaccines. So it's the first time I've actually met you virtually.
Yes.
So it's nice to meet you, Kim. But Kim, you've done some amazing work throughout the pandemic. For my viewers who are watching, I've actually had, I think one of your charts that you did is actually on one of my videos. The work you've done has been really impressive. And recently you wrote an article for the Toronto Star entitled "How the Vaccines Work Against All Variants." And I just thought this is such a crucial topic right now. It's so timely. And the article is really excellent. And I'll put the link to the article in the description of this video as well. And we're going to talk a little bit about that. But first of all, Kim, so we can get to know you a little bit, can you tell us a little bit about your work? I know you work at Sick Kids and you're a researcher. Can you tell us a little bit about your role at Sick Kids and what type of work you're doing these days?
Sure. So I'm a postdoctoral research fellow at the Hospital for Sick Children, or Sick Kids, in Toronto. I work in the Research Institute, so it's a separate building from the hospital. I'm not involved in patient care or any clinical work at all. I just do cell biology research. So this has kind of been my passion throughout my research career, is just understanding how cells work, how they function, how they communicate and interact with their environment. I've studied how they divide. And currently I'm studying the role of cells during development. I'm using fruit flies as a model to study development. And I'm looking at how cells in a tissue will kind of form. It's similar to a process in wound healing. So how the cells will close up around that hole, around the wound, and then will form a nice clean seal. So that's what I'm studying. Nothing at all to do with vaccines. So my vaccine work is not related to my actual research. And this is kind of something I do recreationally, I guess.
Yeah. But the area of cell biology, I mean, you have to understand the physiology of the body. There's a lot that you have to understand about the mechanisms of what goes on in a cell. I mean, it's very complex, right?
Yeah, definitely. And what's fun is that these new vaccines that we're using for COVID-19 really harness the power of the cell. That's all they're doing, is a really classic cell biology. So that's kind of how I was able to get started in learning about the vaccines.
Has it been fascinating for you to see how these vaccines have been developed and just study them, and from your perspective as a research scientist?
Yeah, it is really cool. It's really nice to see really basic processes in the cell being used for such a powerful tool against fighting this pandemic. And it's also kind of fun to dig back through the old research and read up on the old papers that kind of were the foundation of these vaccines, and really appreciate how the fundamental science, I mean, I'm making a plug here because I do fundamental research, but just appreciating how, just exploring how cells work and understanding how cells work has been able to take us so far in development. I would never have thought. This is definitely a turn of fate I didn't expect for the cell biology world.
Yeah, well, something none of us expected, but we're all here. So there have been, I guess there have been some silver linings for researchers and scientists, and just watching all of this evolve has been, well, for me, it's been fascinating as well. I mean, it's been terrible and fascinating, and at this kind of at the same time, which is interesting. So you wrote this article, and you're talking about the variants in this article and how the vaccines work against the variants. So could you tell us, I mean, a lot of people want to know right now about the Delta variant. in Canada and globally, right? So can you tell us a little bit about the Delta variant and how you're seeing this impact Canada right now?
Yeah, so the Delta variant is one of the fourth, I guess, variant of concern, the VOC. And the biggest issue with this variant right now is that it has a lot higher breakthrough. So it's pretty resistant to the first dose, but 2 doses is still very effective and offers a lot of protection against that variant. And that's 2 doses of AstraZeneca or of the mRNA vaccines. So overall, for vaccinated individuals, people who are fully vaccinated, it's still a very good outcome, very good story. But if you only have 1 dose, or of course, if you're unvaccinated, then you're still very susceptible and very vulnerable to this particular variant. So that's one of the biggest issues with this variant. A couple other issues are it spreads very, very rapidly. Right. So it seems to be spreading faster than the Alpha variant, which was kind of the trigger for our second wave, and which Alpha variant already spreads faster than the original COVID that we dealt with.
And Alpha was the B11, formerly the B117, correct?
Yes, exactly. Yeah, the one that was identified in the UK. So that's already an issue. It's spreading a lot faster, and there's potential that it could be even causing more severe illness and sending more people to the hospital. I don't know if that's determined officially yet, but this seems to be where the research is heading. So certainly it's concerning, and we want to be able to keep that under control, but our vaccines remain the best defense against that variant.
And in the article, you also mentioned that vaccination is the best way to get ahead of the variants. And we keep hearing this in the media. We need to be ahead of the variants, ahead of the variants. And I mean, Canada is doing a pretty good job. I think we have about maybe, is it 70%, close to that, people vaccinated with first doses. And I think maybe just under 20% now with second doses.
Yeah, I think around there.
But what does that mean when we are trying to get ahead of the variants?
Yeah, it's like I said, it means kind of 2 things to me anyway. So the first is we want to out-vaccinate the spread of the variants.
Right.
So we can try to protect as many people before the variants. We want the vaccines to get to them before the virus gets to them.
Right.
So that's kind of my first interpretation of what that means and when we say that. And that's, for just preventing illness and potentially preventing infection as well. The next thing that I think of when I think of getting ahead of the variants is getting ahead of future variants. So the development and the evolution of new variants, because this is going to continue to happen. Every time that there's an infection, the virus is replicating inside your cells. Every time the virus replicates, its genetic information is going to replicate, and it can make typos. It's a code, there's recipes in there, and you can make little typos or mutations with every single replication. And sometimes those mutations will change the protein sequence, they'll change the function of the virus, and that can lead to new variants forming. So that's where the variants are coming from. They come from infections. So if vaccines can prevent infections or prevent illness, and prevent the spread of the virus, then we're reducing the risk or the chances of getting new mutations and getting new variants. So vaccines will keep us ahead of getting people sick, and they'll also keep us ahead of potentially the production of new variants that, down the road, maybe we'll be able to get ahead of our own immune system, which we don't want. We want to keep a leading edge on that race.
And so from what you're saying, it sounds like, because I think we usually think of vaccines as protecting us. So I want to get the COVID-19 vaccine so I don't get sick. But what you're saying is that if we are vaccinated, or once we are vaccinated, the chance of us getting the infection reduces. And so the chance of this virus having an opportunity to change or mutate also reduces. And so the chance of variants is less. And that in turn, from my understanding, also protects our community, right?
Yeah, exactly. Yeah, that's one of the ways that vaccines will protect all of us and keep us all safe, is by keeping us safe from future variants and future, altered variations, I guess, of the virus. That's where the variants have come from. They've come from areas and regions of high spread where there's a lot of COVID, and no one's protected through vaccination.
Yeah, and it's particularly concerning with this Delta variant because, like you said, we've seen how rapidly this is spreading, right? I think it's over 99% of cases in the UK now are the Delta variant, and I'm not sure what it is I know it's in Canada, it depends kind of where you are. But I mean, it's spreading really rapidly. And so we want to taper that as soon as.
Exactly. Yeah.
Yeah.
Both for everyone who's unvaccinated and also to encourage everyone who just has one dose to open up the door for them to get that second dose as well.
Now, one thing that I found really interesting in the article, and I hadn't heard this comparison before, is how you compared in the article vaccine resistance with antibiotic drug resistance. Now, as a pharmacist, I know that bacteria can become resistant to certain types of antibiotics. So they create different mechanisms where the antibiotics don't quite work as well. And this is a huge concern for public health because this is becoming more and more prominent. But I'd never heard this compared to vaccine resistance. So can you explain how that analogy works exactly?
Yeah, so to clarify as well, we're really contrasting the two. It's actually quite different, vaccine resistance and antibiotic resistance. So that part of the article we're referencing an article from 2017 from the Proceedings of the Royal Society that explains exactly how the antibiotic resistance and vaccine resistance are quite different. So they outline two main ways that these two processes are very different. So the first way is that in vaccination, what's happening is your body is going to be exposed to, let's say, the spike protein. That's what we're doing with the COVID-19 vaccines. It's going to see this whole spike protein, and it's going to be able to recognize multiple parts of that spike protein. So your body is going to create antibodies that are going to recognize multiple different parts. So let's say if my head is a protein, it's going to recognize my hair, my glasses, my nose. So you're going to have quite a bit of diversity in your recognition of that target. Versus with antibiotics, the antibiotic is going to target really just one protein, one little part of the bacteria. So all it has to do is change that one part. The bacteria has to change that one part, and then all of a sudden you're resistant. Whereas my spike protein in my head, if I shave my head, you're still going to recognize my glasses, my nose. I'd have to make quite a few changes to really make that change. So that's kind of the first way that they differ. And then the second way is the timing of when that intervention is going to happen. So vaccines, you give that to someone who doesn't have any virus yet. And then so now they have a nice protection inside their body, they can recognize the virus. So if they encounter the virus, they have the leg up. They already have a full army trained to bring that virus down and prevent that virus from ever really forming large numbers in your body. Versus antibiotics come in when you're already overrun by bacteria. So there's a lot of bacteria there. They're still dividing. They're still making new populations. They have a lot more chances to mutate and to create resistance and to spread that resistance across the population. So it's those two things. It's the diversity of how vaccines are able to protect you. And also just the timing by giving it to you before you're sick, before you have the virus in you. Vaccine resistance end up being quite rare. It doesn't happen that often. Whereas drug resistance, antibiotic resistance, that happens. It's, as you said, it's a very big problem. It happens a lot. And it might even be a bigger problem after this pandemic too. I think there's been a lot of antibiotics.
I've heard that. Yeah.
Something to deal with in the future.
Yeah. And so thanks for that explanation. That's an excellent explanation. I think of your head now when I think of it. It's very good. I understand, right? And so that is a very good analogy for that. Now, you also in this article, you discussed the immune system still recognizing the spike protein. I think this is what you're getting at, even in mutated form. So when we have these variants, I guess that is exactly what is happening. Is the immune system is still able to recognize that even with these small mutations.
Absolutely, yeah, exactly. Because you still have those other targets. Even if the antibody loses a target, let's say I change my glasses, maybe it'll still recognize the glasses more or less, but it's possible that it'll lose that target. It's still going to have a lot of other areas that it's going to recognize. And there's also a sense of a certain adaptability in our immune system as well. Our immune system is used to encountering viruses in the wild that change. And we're usually able to pick up on those small changes and then kind of re-trigger our immune response and be able to remember those changes in the future.
Yeah. The immune system is incredible. Sorry?
A lot of the T cells will do that for you.
Yeah. And the immune system is incredibly complex, and it really is like you said, it's like an army. It really is like an army. It's like you've literally trained up this army, and as soon as they see this thing, they're just going to go at it before it can become a cytokine storm, right? Which is what we see in COVID.
And that's the other end of your immune system, is that it's a little too strong sometimes.
Yeah.
You don't want it to go into overload.
Yeah, that's right. Because it's hard to turn it back. We see that with anaphylaxis as well, right? Once you have someone in anaphylaxis, you don't address that early on, it can snowball. I've seen it compared to like an avalanche, right? So the immune system is super powerful. And this memory that we're trying to create with the second doses as well is incredible that we can do that. But this brings me to a question that has come up quite a bit. I mean, especially lately, we've had, and maybe it's due to different publicity or something, but how do you then explain breakthrough infections in people who have been fully vaccinated? I know that the vaccines are not 100% effective, so that maybe explains part of it. But are the variants possibly responsible for this, or?
Yeah, so there could be some higher degree of breakthrough. I think that there are some variants that have a slightly decreased effectiveness. I think particularly the Gamma variant, that's B1351.
Yeah.
But there's still a really high degree of effectiveness. If it goes, actually, if we go back to Delta, I think with Pfizer, it went from 95% to about 88%. So it's a bit of a drop, but it's still very, very high. So it's still well within the range of getting really high protection. And I think the big difference here too is that we're still going to get lots of protection against severe illness, hospitalization, and death. Yeah. So even if you have more likely to get symptoms, the overall severity, the overall impact is going to be diminished. But in terms of breakthrough when you're fully vaccinated, this is something that I definitely never thought about before the pandemic, before I started talking about vaccines all the time, before vaccines ruled my life. Because I just thought of vaccines as like, well, now you have a force field. That's your immune system is this force field. But it's not, apparently. So immune system is really more like security guard patrolling the building instead of bouncers at the door. Sometimes it can be a bouncer at the door, but it's not always. So you can still get virus getting in. It can still get into your cells and start replicating a little bit, and that's where you can still get an infection. But your immune system is going to catch it early, and it's going to be very smart in its approach because it has this trained immune system. It's this trained army, this trained antibody force. So it's able to target it, bring it down, and prevent that viral replication from getting too far and from getting a very severe illness. So that's how the vaccines will still work. But yeah, we know that people are still going to get sick. It happened in the clinical trials. And of course, we're seeing it in the real world. And, we talk about 95% effectiveness, that's out of 100.
Yeah.
We're looking at billions of people now who've been vaccinated. And there's going to be a certain point where more people are vaccinated than unvaccinated. And then it's going to look like only people who are getting sick are vaccinated. So it's just going to be a weird switch at some point.
That's a good point. That's a good point. We are going to see more people who are getting sick who are vaccinated. Yeah.
Yeah, like relative, because population is going to change.
Yeah, but, that's a good point.
Yeah. I think it's hard to count. I mean, it's easy to count who's getting sick because that's what we've been doing, right? We've been doing this whole pandemic. But it's hard to appreciate how many lives have been saved and who's not getting sick. And that's been true for, wearing masks. It's hard to imagine what this past 18, 19 months, I've lost count, but this would have looked like if we weren't wearing masks, if we weren't social distancing, if we weren't working from home, what would the world have looked like if we hadn't been taking those measures? Same thing with vaccines. Vaccines are even more effective than all those things. But, I think one thing that we can do, or at least that I can see in Ontario, is comparing what's been happening in long-term care in terms of like how effective the vaccines are. So long-term care in Ontario had two very devastating waves last spring and then last fall into the winter. And it's gripping at my heart because I have family in long-term care. So it's definitely something that is really scary. And a lot of people died, unfortunately, and a lot of people got very, very sick. That includes residents and staff. And then in December, as soon as the vaccines came, there was a really strong vaccination campaign that happened in the long-term care system, and the numbers of cases just plummeted. It went right down. And Ontario did have a really bad third wave in the spring, in March and April, but long-term care did not. There were very few outbreaks, very few cases. There were very few deaths. I think there were maybe a couple, but nothing compared to what wave 1 and wave 2 looked like. The fact that there was even more COVID in the community than there was in the second wave. And with the alpha variant that spreads really, really rapidly. So it made a huge difference, definitely. So it's hard to appreciate the impact that it has, especially when you do see people who are getting sick. And it's hard to say, someone got sick, well, maybe it helped you a little bit, but we can kind of assume that it's helping a lot based on clinical trials and based on what we're seeing. In the real world too, there's a lot of evidence. People are studying and seeing that there are breakthroughs, but they're less severe, and it's going to be more like a mild cold.
And I mean, it is a testament just to the efficacy of these vaccines as well, because we know that older people generally, there's something called immunosenescence. We often see lower efficacy of vaccines in older people. And so the fact that these vaccines have put a huge halt on these outbreaks so quickly and so dramatically is really a testament to the fact that they really are working. And like you said, then starting to see much more COVID in the community than in these homes, right?
Yeah.
And, and something else I want to just kind of mention is that when you see these efficacy rates, like from the clinical studies, we kind of touched on this already, but everyone will not have as high of or as good of a response to the vaccine. There are a lot of people in Canada that are immune compromised, right? So that's something to think about as well. And, I mean, personally for me, the important part, and you've said this, is the protection from severe disease, hospitalization, and death. If I'm vaccinated and I still get COVID-19 and I'm in bed for a day or two or have a cold for a little, I mean, I'm okay with that. That's okay. And if that still counts as a case, then fine, that's still a case. But, we're going to see this hopefully become much less of a threat through these vaccinations, right? And that's the goal here, is to make this more kind of like hopefully like the common cold or something like that. I might be getting ahead of myself, but that's hopefully kind of what we're hoping to see. And we are starting to see that in Canada, even just with first doses. We're definitely seeing the impact of the vaccines. Yeah. And do you have any information for us on how these vaccines might prevent transmission of the virus? Because I know a lot of people have been thinking that, well, why should I get vaccinated if I can still transmit the virus? How is it going to really, really have an impact?
Yeah, that was something that I think was tricky to communicate at the beginning, because the message was, we don't yet have the data, we don't yet have the evidence. And I think it often was interpreted as it doesn't prevent transmission, it doesn't prevent. So that was a bit tricky, I think, to highlight how great all the vaccines are, without, we don't want to make promises that we can't keep.
Yes.
And we don't know how effective they're going to be at reducing transmission. So I don't think it was ever doubted that it would reduce transmission a little bit. We just didn't know how much. So what the clinical trials were able to tell us is what is the reduction in risk of getting symptomatic illness. So it was just, if you have symptoms, take a COVID test or whatever wherever the parameters they used in their clinical trials, because each one's a little different. And then that would check off as a case, and they would compare who's getting sick in the vaccinated group versus the unvaccinated group. But they weren't, testing people every single day. They weren't seeing if there was asymptomatic illness. They weren't able to catch that in most of the trials. And they also weren't looking at transmission. They weren't looking at, in your cohort, they weren't doing contact tracing to see who was getting sick. So we didn't have that information from the clinical trials. But since then, the safety and the efficacy or effectiveness has continued to be studied in the real world, post-clinical trials. And so now there's a lot more information. And some of this has been summarized as well by NACI, the National Advisory Committee on Immunization. So they're like the leading authority when it comes to vaccines. They'll be advising Health Canada. So they do have a nice little summary that's in very technical language for some of the evidence that's available. So there are kind of two aspects to reduce transmission. One is, I guess, transmission directly. So it's reducing viral load, the amount of virus that you're going to be shedding or expelling when you're sick. So there does seem to be a bit of a reduction from some studies. So that's really good news. And then the other aspect is getting infected in the first place, getting that asymptomatic illness. So that was something that was missing from clinical trials. But now in the real world, just from taking, PCR tests regularly, or I think they're doing antigen tests as well. Most of this is from the US.
Yeah.
There does seem to be a reduction in the risk of getting asymptomatic infection. So that means the overall number of infections are going to be decreased in a vaccinated world. The number of symptoms are going to be decreased in a vaccinated world, and the number of hospitalizations and deaths, just everything. COVID is going from this big thing that has been choking us out for a very long time to hopefully a very small problem that's going to be a lot more manageable and easier to deal with. So, yeah, overall, it seems like, yes, it's going to be blocking transmission, it's going to be blocking infection, not completely. There's still going to be some risk, and that's why we still have to consider all of our other public health measures until we really get this under control and can move on.
Yeah. And I mean, just like we can transmit a cold to someone else, or we can transmit the flu or something to someone else, kind of like that, but without the huge threat that it is. And so vaccination just kind of takes that edge, that competitive edge off of the little bug.
Yeah. I like to think of it as like it's turning COVID from a tiger into a kitten.
Yes, that's right. That's right. We could use that. We could definitely use that. That's a great explanation. Thank you. So, in Canada, like I said, we are doing really good with first doses. Second doses are just kind of starting. We're starting to accelerate that. Now, we noticed in the US was, they were amazing with their vaccination program, their rollout, like only the US can do. It was like incredible to watch from this side of the border, but it seems to be kind of slow. Yeah, it seems to be kind of slowing down, and we're starting to hear about hesitancy of getting second doses. This is becoming a bit of an issue in the United States. What are your thoughts on that? And do you think that is something that we might see in Canada, or maybe we're starting to see here?
Well, so far the second dose rollout is really fast in Canada. So it seems to be really, I think people are really, really waiting for it. So that's good news. But yeah, I'm not sure exactly kind of what factors are happening in the US about. I think most people have gotten their second dose, so that's good. But there certainly are some people who, for whatever reason, have not gotten their second dose. And I'm not sure. Maybe some people don't feel they need it. They don't see the reason. I think that now that the US is starting to implement a bit more of a, if you get vaccinated, you can travel, that kind of thing. As we're going to see more of that, I think that's going to give people more incentive to get that second dose. Maybe they don't realize that if you missed the second dose, it's okay. You can go get it anytime. You're not bound to that.
Right. The timeline, right?
Yeah. You don't have to start over. If you missed it, just go get it.
Yes.
So that's one factor. The other thing too is, there are still a lot of people who haven't gotten their first dose yet in the US as well. I think they might only be around 60% of the eligible population.
That's still a lot, yeah.
Yeah, it's a lot, but there's a lot of people who are unvaccinated. So that's certainly a really big concern for Delta, which is going to push through that unvaccinated population. And that's very scary, I think. A lot of people are still very vulnerable and maybe don't realize. I think that the US, my perspective is that I think they declared victory a little bit prematurely. I think that there is a lot of pressure to do that. And I think that we're seeing that in Canada too. Everyone wants to say they've beat COVID, but we're not going to beat it until the whole world is vaccinated. And even until your own population, you want to make sure Delta is kind of pushing the boundary of where that herd immunity magic number is going to be. I think the latest numbers I've heard is like 90% of the population. So we really need a lot of people to be fully vaccinated, fully protected, so that it's not disrupting our lives. And, you don't want people to be left behind either. There's a lot of people who maybe don't have access to vaccines. If they can't take the time off work to go get vaccinated, if they're worried about any side effects, some people get headaches, some people might get a bit feverish after the vaccine, which is just your immune system being active, and not a concern, but that can take someone out of work. And if they don't have paid sick days, they can't access that. If no one has talked to them about vaccines before, if they have questions and there's no one there to answer them, there's those are kinds of accessibility issues that maybe aren't being addressed for people. And it's important to meet people where they're at and really speak to them with compassion, with understanding, and understand what the barriers are, understand why people might not want to, or why people aren't at all or can't, and try to reach those people as much as possible.
Yeah, it's not as simple as we may think when we just see the numbers of this percentage and, well, that percentage needs to still get vaccinated. Well, go and get your vaccine. It's more complex. It's not always just people who are saying, no, I'm not doing it. You know, people do have their reasons, and also they have a need to make informed decisions, right? And accessing that type of information is not as easy for some as it is for others. And that's been a glaring part of this pandemic, for sure. And so when you speak of second doses, we're hearing more and more how important it is to get the second dose. Can you speak to that a little bit? You did touch on that in the article. For some people who might be watching this, they might think, well, I have my second dose. I feel good. I'm going to enjoy my summer. COVID is disappearing. And the importance of the second dose is something that maybe we could touch on a little bit. What are your thoughts on this?
Yeah, definitely. You know, one dose does offer a lot of protection. So I think that was something that I was trying to encourage people with the first dose, or just try to reassure them with the first dose, because we had that 16-week gap, and that was really intimidating for a lot of people. And they're like, well, I don't want to get it if I have to wait that long. I'm like, well, get it and let your anxiety trickle away a little bit, because you will get a lot of protection. But we don't know how long that protection is going to last with just one dose. The idea of a second dose is really to reinforce all of those pathways. You have a great video actually that explains it. Your second dose is kind of, you know, the double take for your immune system. Right. And maybe you weren't paying attention the first time, but that second time you're going to really get all the details of my head. Yes. You know I'm someone who tends to forget people's faces, so I need that second exposure.
I do that too. Yes.
I'll forget their name, and I can relate to the immune system on that level. And it's not always like that. Some vaccines are able to get the immune system going with just one dose. Some need 3. You know, it's every vaccine is going to be a little bit different. So just so happens with these vaccines, it's really 2. And you know, maybe a third one would have given even more, but 2 seemed to be good enough, and it's proving to be good enough in the real world as well. So it's 1 dose is good, 2 doses better. 2 doses really, that's going to give you the maximum benefit of vaccination. That's where we're really going to see the long-term effects, the long-term benefits, the long-term protection. That's continuing to be monitored, so we're seeing in real time how long-term we're going to get. And that's also going to, you know, strengthen your protection against, well, we know against the Delta variant. So already that's showing the kind of the flaws or the holes of just 1 dose for Pfizer and for AstraZeneca and for Moderna. So we know that we definitely need 2 doses for these vaccines to get the maximum protection. So, and most likely, you know, you're not going to be considered fully vaccinated if you only have 1 dose. Not the same for Johnson & Johnson, which we're not really using yet. But if it's a 2-dose vaccine, you need both doses to be considered fully vaccinated. So that's going to be important for, you know, for travel. I don't know what that's going to look like exactly, but I think Canada just announced that we're going to be releasing a lot of quarantine measures for people who are fully vaccinated. So that means 2 doses.
Yes, get your second dose, please. I mean, it protects you against future variants as well. We can't predict what a future variant would look like, but with what we've seen so far and how effective these vaccines have been against the variants thus far, and with the possibility, because like you said, this is a global issue, and we still have COVID raging in many parts of the world, and many parts of the world, their vaccination programs are just beginning. Maybe they haven't even started. Everyone in the world is kind of on a different timeline here. So, you know, protection against possible future variants is something, I mean, I'm just saying this, I have no data on this, but based on what we've seen so far, it's something that that second dose, that just reinforcing the immune system with that second vaccination can really help. And yeah,
that's a great point too. I know I've had some friends say that they weren't sure about getting vaccinated because, well, there's going to be some next virus or some next variant, and then they're going to get a new vaccine. And I was like, well, this was January. I was like, I mean, I don't know, maybe not, because your immune system is probably going to figure it out, but we didn't have the data yet. Now we have the data, and so far the immune system figures it out. So far we're protected by these same vaccines. Still very possible that we're going to need that there's going to be a new variant in the future that's going to require a booster, and we don't know what that's going to look like. We don't know who that's going to be recommended for. It might just be some population, some age groups. We don't know. But we know that right now we have great vaccines that work, that are safe, and they work against the variants and the viruses that are here today. And, it doesn't make sense to remain vulnerable to these viruses, waiting for another vaccine that might not even need.
And I mean, the other part to this is that I don't know what you think about this, Kim, but I think we will have another wave in the fall. It'll be much smaller, but just like we see colds or flus, I mean, it's quite possible. I shouldn't say we will. I think it's possible that we will have another wave in the fall. And so people who might be waiting for that second dose or just kind of unsure, you could get fully protected, full vaccination before we see the cold and flu season. We didn't see flu last year really, but I wouldn't be surprised if we see it because of these measures that are slowly being more relaxed. So vaccination might help you then as well, because if you're just starting your vaccine program or you're getting your first vaccine, say in October or November, I mean, that's okay, but it takes a while for you to become fully protected and to have that protection that we're speaking of.
I agree,
Kim, sorry, go ahead.
I was going to say, I think getting those vaccines in will help hopefully prevent another wave, but I guess we'll have to see what the fall looks like.
Yes, definitely. And I mean, I hope that I'm wrong, or maybe we just see a little blip or a small rise in very, very minor cases or cases that are not serious, right? But the more people that get vaccinated, the less chance of us having this type of wave. And are we going to need boosters in the future? I don't know, but do we want to get out of this right now? Yes. So definitely. So I think let's get out of it and let's move on. And it's hard. I know it's hard when the science is evolving so quickly. I mean, it's been hard for us too, right, Kim? It's hard for us to keep up too. So definitely have sympathy for that. Kim, you've been very busy, because in between the time I asked you to do this interview and the time that we're talking now, you've written another article with a couple of other individuals from our COVID-19 group, Krishana and Mira. And I just wanted to touch on that article quickly before we finish here. So the title of your article is Moderna versus Pfizer, or Moderna versus Pfizer, Why We're Not Playing Favorites. Are people playing favorites with vaccines in Canada, Kim?
Apparently. Apparently so.
I think it's only Ontario.
It's just an Ontario problem.
No, it's not.
Apparently I'm hearing down the pipeline that at vaccine clinics, people are showing up to their appointments and then walking away when they find out that they're not getting their favorite vaccine, which apparently Moderna has been the least favorite and Pfizer has been the favorite. And I don't know where this is coming from, but we try to address some of the concerns that we've heard in that article.
Yeah, so you looked into this and you kind of dug into why this might be happening. And one of the things that you looked at were side effects, because I have heard that some people think that maybe the side effects from a certain vaccine, Moderna, are worse. But you dug into this data and that's not true from the data that we have. Is that right?
I mean, they seem pretty similar. I think there might be, we have a couple of graphs in that article. So there might be a bit more muscle aches with Moderna, but I think they kind of average out. They seem to average out in my view on that, on those charts. Overall, the symptoms are infrequent. Most people don't feel too severe symptoms. I think the most common is going to be muscle pain at the injection site.
Yes.
I think that's a given. I think that can be expected, but there's a lot of things that are rare. I also did hear that Moderna was going to have maybe more side effects. I think that was from the clinical trial data.
Okay.
But yeah, I think what we're seeing there was the adverse events following immunization, which is a reporting site where any adverse event will get reported that comes through a doctor or goes directly to public health. They seem to be, coming out with similar levels of non-serious or serious events. And these are just anything. It's not necessarily caused by the vaccine. But yeah, overall, it seems pretty similar. I mean, I think maybe the wording was throwing people off if you're saying, no, it's going to be more. But I think overall, they're mild. They're not severe. And they're not going to, interrupt your life too much. And of course, sometimes they will. Sometimes you might get a bit feverish.
Of course, everyone's different too. Yeah,
exactly. Everyone's going to be a bit different. You can't really predict how you're going to feel after the vaccine. So I don't think that there's a big difference. I don't think that. I would hope that that's not going to stop someone from wanting to get vaccinated, because the point of getting vaccinated is to not get COVID, right? And that's the takeaway, is that a lot of people are working in conditions where they're more likely to be exposed to COVID, and you don't want to take that risk and take that gamble.
Yeah, and you even dug into comparing the ingredients, for example, in the vaccines, and they're so similar when you break this down, right? Did you see any notable differences or any observations there?
Probably the most important one is the presence of tromethamine, or tris, in Moderna. So that can be an allergen. Some people might be allergic to that. So that's something that, if you're allergic, you'll know. It might be in contrast media, contrast dye, if you're getting
That's in Moderna.
So that's not present in Pfizer. That's probably the only really notable difference. Everything else is just simple salts and lipids, which are kind of like fatty molecules that helps form a bubble around the recipe, the genetic recipe, which is the mRNA. Everything else is quite similar. They're really there just to maintain the stability of the injection mix, the injection cocktail. And they also will change the storage conditions, but they're not going to change the safety or the effectiveness, how well the vaccine is going to work. And the most important thing is the protein that's going to be created in your cells in response to that recipe is the exact same. I think they're the exact same. There might be slight little changes here and there, but nothing significant that's going to change how your immune response sees it. I'm just going to see the same protein. And this is, adding to that, this is why the two vaccines are considered interchangeable.
Right.
Ideally, first, second dose, you stick with the same vaccine. If it's not available, you can switch. This is a new kind of thing that was kind of buzzing around on Twitter as well.
Yes. Yeah.
But that's the official guidance from NACI is if you can't get the same vaccine first, it's okay to get a different one second, because they're so similar. And that's we touch on that in the article as well.
Yeah, and you and I were talking just briefly just now about why we have seen this preference essentially towards maybe one brand or another brand. And I don't know if it's maybe something cultural, or maybe something like you said, it was communicated at the beginning. If you get this vaccine first, you should get the same vaccine second. I mean, that's the data we have from clinical trials. You also posted something recently saying that the actual manufacturers cannot tell you that it's okay to have another vaccine second, because this was not the basis of a clinical trial, right? Was there another reason for this that you had mentioned, or?
It's just liability issues for the manufacturer. They can't advise, or they can't officially tell you that it's okay to use their products in a way that's different from how they've tested it.
Right.
If they don't have the evidence to back it up, they can't say it. So I had heard some people say, well, the vaccine manufacturer says that we can't switch them. Well, of course they have to say that. Yeah, they absolutely have to say that. And it's true that no one has switched Moderna, Pfizer. We don't have the effectiveness data. We don't have those numbers, but there's a certain, the NACI has a long history with vaccines. Switching vaccines with other types of vaccines is common. It's something that happens a lot. So it's not a new thing. It's not a new concept. So they're not operating without any information here. They have a lot of prior experience that can give them a bit of intuition on how this is going to happen.
And so if someone's watching today and they might be someone who is a little bit hesitant, and maybe they have to get a different vaccine for their second dose than for their first dose, what would you say to that person who's a little bit nervous about this? I mean, even culturally as Canadians, I think, like you said, we kind of like to be a bit more by the book, maybe. This is a little bit outside of our comfort zone. I mean, getting the vaccine maybe was already a step out of our comfort zone. Now you're asking us to get something a little different. This feels a little bit uncomfortable. What would you say?
Yeah, I mean, I know it's confusing and frustrating when the advice will change. I mean, this really is a sign that we're adapting and we're learning. We're getting new information. Sometimes our advice is based on we don't have enough information, and then the advice changes once we get new information. So that's kind of why that advice might change. My first piece of advice would be, talk with a trusted healthcare professional, a pharmacist, doctor, nurse, your vaccine administrator. They're professionals.
Yes.
That's a perfect person to talk to. So if you show up at your clinic and you're not getting the vaccine you expected, please talk to that person first.
Don't walk away.
Don't walk away.
Use your appointment.
Have a conversation.
Use your appointment to gain knowledge. Yeah.
Exactly. Yeah. So just, take a minute and have that conversation with anyone, any staff member there, anyone who's working there, or the person who's giving you the vaccine. They will have the answers for you, and they'll have a lot of information for you. So it's important to have questions, ask them, and then get the answers, right? We want to get answers. So I really appreciate that people are motivated and want or asking questions, but it's important to get answers too. So that's my advice, is to get the answers that you're looking for, and just know that that's the advice coming from the leading authority on vaccines in Canada, from NACI, is that yes, these two vaccines can be switched around, Moderna and Pfizer. If you have the option and your same vaccine is there, get the same one you got for the first dose. If it's not available, it's okay to switch.
And it's so important for people to know that questions are good. Some people are okay with no questions and they just walk in, they just give it to me, and that's good. But it's not okay. I mean, that's not something that everyone likes to do. And so questions are good. Informed consent is informed, right? So look for that information from credible sources like your healthcare professional or your vaccine administrator. COVID-19 Resources Canada is another resource that people can definitely go to for any questions or concerns. I think that's a really good point, that questions are not a problem. We like questions, and you need to be informed about what you're doing, and what vaccine you're getting, and how it's going to work, and that kind of thing. So yeah. Oh, Kim, this has been so great. I will post the links to your articles. Maybe you'll have another one by the time I post this. I will post the links definitely in the description. Kim Gauthier, you're on Twitter. People can definitely find you. Kim has some amazing science communications out there. It's great to follow her and just stay informed if you're interested. Kim, is there anything else you'd like to add today that we didn't get to touch on?
Sure. I'll add one last thing, I guess.
Sure.
If there's something holding you back, or anyone watching who's not gotten vaccinated yet, and you feel that you're waiting. I know a lot of people want to wait. They don't want to be first in line, and that's okay. But don't take yourself out of the line either.
Oh yeah.
It's been over 6 months now of using the vaccines around the world. We have probably 3 billion. I haven't even checked in a while. It's a couple billion at least.
Yeah.
People vaccinated around the world. These vaccines have been used over and over again. If there is something that's still holding you back, something you're not sure of, you just feel not yet, I would encourage you to just, think about what it is that's holding you back. And, what are those questions that aren't answered yet? What are the questions? Find out what it is that you're waiting for, and then try to get the information that you need to help you feel confident, because, this isn't forced. It is absolutely everyone's choice, and I support that. Yeah. And I want people to make informed decisions, and I want them to, whether they get it or not, to know exactly what it is. But if it's just this kind of ambiguous, I'm waiting, it can be 2 or 3 years, right? You don't want to wait too long. So that's the only thing I would say, is that there's a lot of information out there now, and if there's something that's still on your mind that you're still not sure of, there are definitely a lot of people that can get answers for you, and whether it's this channel, this video, or another resource, there's always someone there who's going to help you to get those answers.
Yeah, that's excellent, Kim. And I mean, now that we have the vaccines, COVID-19 is now a vaccine preventable disease, and we would hate for someone to get a severe illness and really suffer from something that was preventable. And so do ask questions and seek out these resources, and don't stay in the waiting place. I love that message. That's really good, Kim. Yeah. Thank you so much for joining me today, Kim. This has been really enriching, and really appreciate all the work you've been doing.
Well, thank you so much for having me, Lindsay. Thanks for your questions.
Yes, take care.
Thanks, bye.
Bye-bye. Well, I hope you enjoyed this conversation with Dr. Gauthier. Dr. Gauthier has been doing some incredible work throughout the course of the pandemic, and it was such a joy for me to be able to interview her and bring some of the great information that she has been bringing to the public to you today. Thank you so much for joining me. Take care and stay healthy. Bye-bye.